as chair of the Marriage and Family Therapy Advisory Committee of the Kansas Behavioral Sciences Regulatory Board. I'll ask the members of the advisory committee to respond to the roll call to signify their presence at this open meeting that's being conducted remotely by conference call or other electronic medium. Jim Kilmartin.
Present.
Nicole Eitzen. She might not be on yet.
I see her in the room, but she has not unmuted. So.
Okay. Chris Haben.
Here.
Betsy Henderson.
Present.
Marcy Lichtenberg. Oh, she's coming late. Oh, there you are. There you go. Sorry. And Diane Siebel.
Here.
And Heidi Vella. She will be running late. Okay. I note that the following BSRB staff members are also present: David Fye.
Here.
And Leslie Allen.
Here.
Next. And David Fye will read a message about this meeting being held remotely.
Thank you, Mary. This is David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at this meeting as no individuals had requested to provide public comment. Because we are connecting this meeting, public meeting remotely by conference call and other teleconference ability, I state for the record the following information. Public access to this meeting is conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is conducted remotely, the requirements of KOMA are not suspended, so we will be conducting this meeting pursuant to the KOMA. On June 28th, 2024, we sent notice of the advisory committee meeting to all individuals who had requested notice of such meeting. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting material have been posted on the BSRB website and are available for review. You may also request a copy of the agenda specifically by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if we have any technical issues during the meeting, you may call the board office at 785-296-3240 or send an email to bsrb@ks.gov. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link to the meeting on the agenda. And the conference call line is active. I checked it before we got started. There's no one currently on the line. If I hear someone beep over, I will let you know.
All right, thanks very much, David. The first item of business on our agenda is approval of the agenda. Did anyone have any addition or changes? If not, I'll take a motion to approve.
I move we approve.
Oh, I hear you, Nicole.
Sorry, when I have to switch between mediums, sometimes it's hard. I did have a question, and it might have been caught already. On here it says Friday, August 19th at 10 a.m. on the agenda. I don't know if that at the top it says Monday, in the middle.
Oh, thank you for that. We'll make that correction. Anything else?
I was here Friday, Mary.
I bet you were. If there's no other changes, can I take a motion to approve the agenda?
So moved.
Second?
Second.
All those in favor say aye.
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 Any opposed, same. Thank you. Any opposed, same sign. Great. Well, I'd like to officially welcome our two new advisory committee members, and I think it'd be nice to give a brief introduction of everyone so they also can get to know us and we can get to know a little bit about them. So I'll kick us off. I'm Mary Jones. I am chair of the Marriage and Family Therapy Advisory Committee and past chair of the BSRB and continuing and still a board member. My daytime job is I'm president and CEO of Mental Health America of South Central Kansas. It's great to be here with you, and I'll hand it off to Jim.
My name is Jim Kilmartin. I am a retiree. I do not have a daytime job other than to travel the world. In between travels, I partake in this meeting. I was appointed by the governor of Kansas 2 years ago. I am now in my third year of a 4-year term. Fully enjoy all the committees and things I've learned. I retired from Stormont Vale Health after 40 years as a risk manager corporate compliance officer.
And let's go to Diane.
Hi, I'm Diane Seibel. I am a clinical marriage and family therapist from Friends University, and I live in Wichita. My daytime job is I'm the director of clinical services for Amber Hope Connections, the new case management contract in Sedgwick County.
Glad to have you. Marcy.
Hi, I'm Marcy Lechtenberg. I'm a clinical licensed marriage and family therapist. I recently retired as director of clinical training for the couple and family therapy program at Kansas State University, and I now own and direct a small private practice here in Manhattan. And this is my last day, just starting my second term.
Great. Nicole.
I'm Nicole Eitzen. I am a marriage and family therapist at Horizons Mental Health Center. I'm the director of CCBHC and quality here, and I also just began my second term.
Excellent. Chris.
Hi, I'm Chris Haven. I'm a professor of marriage and family therapy at Friends University in Kansas City. I serve as the program director here. I've been doing that for the last 23 years. I've had some experience in leadership with AMFT, and yeah, I'm a clinical marriage and family therapist here in Kansas and an LMFT in Missouri.
Betsy.
Hi, I'm Betsy Henderson. I am an LCMFT in Kansas and an MFT in Missouri and California. I first got licensed as an MFT in California. I now am just actually retired from well, not really retired, left the corporate grind, left Optum, where I was the director of behavioral health for Kansas Medicaid for United Healthcare, left that at the end of April, and I am now running my private practice full-time on the Missouri side. I'm also doing contract outpatient therapy work for Lake Mary Center's outpatient therapy program and doing PRN work for Research Psych on the Missouri side.
Well, welcome. We're glad to have you.
I'm excited.
Leslie? Yeah, Leslie.
Hi, my name is Leslie Allen. I'm the Assistant Director and Licensing Manager for the BSRB, and I have been here for 25 years. I'm glad to meet you guys.
And Dave. You've probably already introduced yourself, but
Thank you, Mary. I appreciate it. Yes, I'm David Fye, Executive Director for the Behavioral Sciences Regulatory Board. And I've been in my role now coming up on 4 years in November. And I wear a few different hats around the office here, but it is really nice to meet Diane and Betsy in person, face to face by screen. We've had interactions by email, and I appreciate your interest in serving on the advisory committee. In Kansas, I think we have an excellent model in terms of how we conduct business. We have a composite board, as you're aware, where we have 7 professions with 1 board. And so a lot of the work that's unique to each of the professions takes place at these meetings. And that's why it's really, really important. And I really appreciate both of you volunteering your time so that when there's items specific to the marriage and family therapy profession, you can have good conversations about that, good discussion, make recommendations back to the board. And when the board refers a topic to the advisory committee, that gives the opportunity for professionals and licensees in this area a chance to have conversations about those things and provide that back to the board. So I'm glad to meet you both today and look forward to working with you both in your position as the advisory committee. And by the way, I just want to let you know, if you do have any questions after the meeting, feel free to reach out to myself. Leslie is also a really good resource. She serves as both the assistant director and the licensing manager. I know when you're new to serving on a committee like this, that might be a little different than some of your committees you've served on in the past. We will have a formal training for board members and advisory committee members. We do that once a year. That'll take place at the next advisory committee meeting in October. And so we'll go through a lot of the technical rules like the Kansas Open Meeting Act, like I mentioned earlier, the Kansas Open Records Act, things like that. One thing that I just kind of like to stress to new members is that if you're used to working with different groups and doing a lot of work outside of public meetings, that is something that we need to avoid when it comes to the majority of members in the committee. So when we conduct business that involves the majority of members of the committee, that involves the work of the committee, that needs to take place at these types of meetings. And that can refer to things even like sending emails back and forth where there's interactive discussion. And so on behalf of the BSRB, I will send out materials to you in advance of the meeting for you to review. Just don't hit reply all and start a conversation with other board members or advisory committee members. Just make sure to save those for the meeting. And if you want to follow up with myself or follow up with Mary Jones in her capacity as chair, that's perfectly fine. Just don't include the majority of members of the committee. And we'll talk about a few other technical rules kind of like that, but that's one that if you're not used to this format can catch people by surprise. So I will be happy to provide guidance to you. And like I said, if you have any other questions about anything, feel free to reach out. We can schedule a time for a phone call or a Zoom meeting. Happy to get you up to speed in terms of your work here on the advisory committee.
Okay, thanks so much, Dave. Our next agenda item is going to be the review of the minutes from our previous meeting. Those were in your packets, so if you need time to review that, please go ahead. If we've already gone through them and there aren't any changes or suggestions, I'll take a motion to approve.
I move to approve.
Thank you, Jim. Is there a second?
I will second.
Thank you, Betsy. All those in favor say aye.
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 Any opposed, same sign. Okay, Dave, I'll hand it to you for your report.
Okay, thank you, Mary. So for some of you that are new to the advisory committee, one of the items we have on our agenda each meeting is an executive director's report, and that gives me the opportunity to share information with the advisory committee. Some of these are operations updates for the BSRB. Some of these would be updates from the most recent board meeting. A lot of the work that you'll do as an advisory committee will be to discuss topics relevant to your profession and forward recommendations, but sometimes there will be recommendations the board wants each of the advisory committees to discuss, or specific ones for your advisory committee. So I try to keep you informed about the big items the board is working on as well. So focusing first on operations, we are getting very close to launching a partnership with a company called CE Broker. This is a company that the board has agreed to work with to assist licensees with a tool for the audit process. When individuals renew their licenses, 10% of our licensees are audited, and they have to provide documentation to show they've completed all of their hours of continuing education. Well, right now, that process involves you sending materials to the BSRB. They would be reviewed, and then as long as those all were sufficient, we would pass the audit for you and you could move on. What this company does, it provides a free service to licensing boards like the BSRB. And currently right now, the Board of Nursing and Board of Healing Arts have already implemented this for Kansas licensees. But it allows our licensees to essentially have a free account with the eBroker where they can upload their documentation, continuing education, and assign it in certain categories so that if you are audited, if you have chosen to upload those into the portal, we can log into the CE Broker account and verify that you have completed all of your hours, that you have sufficient documentation. And if it's all there, we can approve your audit very, very quickly. So it's a nice tool for us to make sure that we can process audits quickly and efficiently. It's a nice tool for licensees. It is optional. So if you don't want to do it that way, you don't have to. But there are some nice benefits to it. One of the items is that you don't know if you're going to be audited until you actually renew your license. And so you may have to hang on to those records for quite some time on the off chance that you're audited. If you just go ahead and upload them to the portal, you really don't have to worry about it too much. And then we can let you know if those are all sufficient when we do the audit. So, so it is a nice thing. We've been working with CE Broker to roll this out. There are different rules for each of the 7 professions. So what they decided to do was to start with one of the professions, then move on to a second profession. So the first one that's going to be rolled out here probably in the next month will be professional counseling, followed by social work, and then the other professions after that. And we will send some messages out by email when we are ready to officially launch that service. But in the last week, we've had some meetings with the e-broker. We've had a chance to see the functionality of it, and it looks very user-friendly. So I think it'll be really beneficial. But like I said, the board wanted to make sure this was an optional thing for licensees. The way that company makes money is they have some upper tier services they can offer, and individuals can choose to do those upper tier services for a fee to the company. But nobody has to do that. But there's enough people that voluntarily choose to do that, that it's beneficial for them to have the free partnerships with the states. For everyone who chooses to do it free, that's fine. And then those that elect to do it for the fee, they can do that. So keep an eye out, but that partnership with the e-broker should go live at least for our first group of licensees sometime in the next month. Moving to some items from the previous board meeting that took place July 8th. And just to highlight a few of the items that took place at that meeting, board members are appointed by the governor. They serve 4-year terms. We had a public member who was coming off the board, Jackie Lightcap, had served her term on the board and was not seeking reappointment. And the governor appointed Denise Bisman to go ahead and become the new public member for the board. So Denise is going to be serving in her capacity as board member, and also will be serving as a public member on the Addiction Counseling Advisory Committee and the Behavior Analyst Advisory Committee. Also, at each July board meeting, the board elects a new chair and a vice chair. And as Mary mentioned, she has served as chair for the last 2 years and did an excellent job. Really enjoyed working with Mary in that capacity. But Mary decided to step down to allow other people the opportunity to serve, and the board elected Dave Anderson to serve as the new chair of the board. And then the board elected Laura Shaughnessy to be the new vice chair of the board. So really excited, happy for both Dave and Laura in their new capacity, and I'll be working with them over the next year in those roles. The board also appointed several members to each of the advisory committees. For your advisory committee, Betsy and Diane were the new members that were appointed to serve on the advisory committee. As you're aware, advisory committee terms are 2 years. So some individuals came up to be reappointed this year. For those that didn't, your terms will end next year, and I'll reach out to you in the spring to see if you're interested in being reappointed for membership. Some of the other items that were discussed and acted on by the board at the last board meeting. This year, the Kansas legislature passed a multi-state compact for social workers. And as part of that, the language said when 7 states pass that model language, the Rules Committee will begin to start meeting to be able to start to work on the infrastructure of the compact. So Kansas was the 7th state. Since that point, many more states have passed that compact. I think now the number is somewhere in the 20s. So there will be a meeting of commissioners. Every state determines a compact commissioner for the process of setting up that compact and having representation. So at that meeting, the board appointed me to serve as the initial compact commissioner for the social work compact. So I will be attending a meeting in September in that role to help them with starting to lay the infrastructure out for that compact. Based on what I have heard so far for the Council of State Governments, their timeline is that they believe they're hopeful that compact will be operational sometime later at the end of next year. In terms of other items the board acted upon at the last meeting, the board discussed some possible changes to the advisory committee expectations. Right now, each of you has had the opportunity to review the advisory committee policy, which is a relatively short document. It's just a little over 1 page. Some of the expectations of members may not be as specific as they could be in that document. There is some language that says the same policies and procedures that affect board members should also affect advisory committee members, but there are some natural differences. The governor appoints board members, the board chair elects or appoints advisory committee members. Board members are able to receive a small amount for attending approved meetings, whereas advisory committee members volunteer their service. And so there's also some question about should there be more specificity? For example, should the advisory committee policy clarify how many meetings advisory committee members can miss? Should there be a distinction between approved meetings or absences versus those that are unapproved? Should there be some language in the policy concerning individuals if they have to live in the state of Kansas or not? So there's a few details like that the board started a conversation on. The board didn't have any specific recommendations for new language to be added, but the board may continue that conversation at a future meeting. If there are changes to the policy, I will let you know. But as of right now, they've just started a discussion on possible changes. And I'll move next to just some notes about future meetings. The board generally meets every other month, the second Monday of the month. And in September, that's going to be a little bit different. Normally, they would have met the second Monday in September. However, once a year, the board likes to get together and have an all-day planning meeting where they can have more robust conversation and discuss items maybe relevant for the legislative agenda for the board. So that meeting will take place in person at the end of September. And so rather than have a regular board meeting and then a couple weeks later have that meeting, the board decided to have the all-day planning meeting on Monday. That'll be September 30th. And then for some of the regular business items, the board will take care of those the Sunday evening before, and that will be Sunday, September 29th. And both meetings will be in Lawrence. They will be open to the public, and that information in terms of the address for those meetings is on the BSRB website. So like I said, these are public meetings, but since they are away from the board office, the logistics of that, they will not be streamed, but any individuals who wish to attend those are welcome to come in person and observe those meetings. And then additionally, in November, the board generally would meet the second Monday of the month, but that meeting would fall on Veterans Day. So to allow people the opportunity to attend ceremonies that day, or in case they attend or work at a facility that is closed that day, that meeting has been moved to the first Monday of the month in November, which is November 4th. And then the last update I will just provide to you, the BSRB is very much focused on outreach and trying to be good partners with other groups around the state of Kansas. We understand there's been a lot of discussion about issues like workforce and other topics relevant to that. And so we have really extended ways to have good conversations and partnerships with others. And so in the past, the BSRB had roundtable discussions with educators where they were physically sitting around a table and having conversations about requirements for licensure and similar topics. But given the prevalence of programs in the state of Kansas and some of the programs that are spread across the state, some of them remote, we thought we might be able to reach more people if we had a meeting like this, but did it remote over Zoom. And so last year, we had a meeting like that where we went over some recent changes in law and then opened it up for a Q&A and had a discussion with educators around the state for the programs that we regulate. And we had about 35 to 40 people attend that last year. So this year, we're going to have a very similar meeting. I'm going to provide some updates on recent changes to the regulation, and then we can have a conversation about some other topics. And so that meeting is going to take place on Thursday, September 19th at 1 p.m. And we'll be putting out some more information about that. But that meeting that's targeted for educators will be on Thursday, September 19th at 1 p.m. Additionally, we will have a very similar meeting, but for the first time ever, to my knowledge, we had a meeting that was really focused on employers for mental health providers. And so last year, this was well received. We had, again, about 35 to 40 different individuals who attended this. And so we will put together a similar meeting that will take place the day after the meeting we're doing for educators. So the informational forum for employers will be on Friday, September 20th at 1 p.m. And any of the comments and feedback we get from those two meetings, we'll be able to summarize and then provide to the board at the end of that month when the board considers items for the legislative agenda. So we will be putting out some more information concerning those two meetings, but I thought I'd announce it here now so that you would be aware of it as well. So with that, I'll go ahead and end my report and see if there's any questions.
Thanks, David. Does anyone have any questions or comments? Okay. Well, as always, a lot is going on and you're involved in quite a few things, but I think it's just really good representation. All these meetings, the resource meetings, the other meetings that you're attending, I know it's really helpful to have that connecting point with our agency. We'll go into old business then, and we're going to go back to the discussion on educational requirements for licensure. When we were looking at putting the agenda together, I think David and I just wanted to be sure that we completed everything we were thinking about in this item. Dave, feel free to jump in here and supplement any information for me.
Sure. So over the last few years, the board has really taken an examination of the license requirements and has looked to modernize a lot of those requirements for licensure. We've had some changes that have gone through the regulatory process recently that have allowed some individuals a little bit easier access to become licensed if they attend remote programs, being able to meet some of the previous requirements that called for someone to be physically at the school. Now some of those can be met face-to-face by screen with synchronous video conferencing. We were looking at this regulation, specifically KAR 102-5-3, which spells out the educational requirements for licensure. And kind of to frame this conversation, I know we have a couple of new attendees at this meeting. Essentially, there are some overarching requirements that individuals must fulfill to become licensed. And the vast majority of the applicants who apply for licensure receive their education from a program that is accredited by a national accrediting body. So for marriage and family therapy, that would be COMFTI. And so if an individual received their education from that national accrediting body, we would be able to move them through the process. And part of that is because they can verify a lot of the standards for those programs and the coursework. And so we know kind of what to expect for individuals who receive their education from those programs. But for individuals who attended programs that were not accredited by the national accrediting body, that becomes more difficult. And so for some other professions under the BSRB, there are states who basically say, if you received your education from a school that was not accredited, you're not going to be able to get licensed here. There's a very clear distinction. They can make a very quick decision, but that decision is going to be no. In Kansas, we provide greater flexibility, and we basically say, if you received your education from a program that is not accredited by a national accrediting body, we still want to see if we can determine if the education you did receive is substantially equivalent to say that you can meet the educational requirements in law to become licensed here. But that process is much more difficult because in a sense, it almost puts the BSRB in the position of an accrediting body. And so we have to look at the program that person attended. We have to look at the coursework that that person received and sometimes extra requirements. And so what this regulation does is it outlines some of those program level requirements and coursework level requirements that individuals would have to meet if they had not attended a national accredited program. And so this criteria had really not been updated for a few years. And so one of the advisory committee members, Chris Haben, volunteered to compare what the national accrediting body requires in terms of coursework to what we have currently in the regulation to see if we are somewhat in line with what the national accrediting body would require or if there are significant differences. And so in the copy of the minutes from the last meeting, you have a list of that analysis and kind of going through those points. And so there was a really good discussion at the last meeting in terms of some of the differences there. At the end of that discussion at the last meeting, there were no official recommendations from the advisory committee for changes, but I did want to kind of bring this back to you and kind of reframe this conversation. If you would like to make changes, you have the authority to make recommendations to the board, and then ultimately the board would be the body that could make recommended changes to the coursework level requirements or program level requirements. You don't have to make any recommendations for changes. If you make no changes or recommendations, then what's in the regulation would just stay the way that it is. But that's why we wanted to bring it back to you, highlighting those items of difference so you could kind of see that. And I know Leslie Allen is on the call too. Leslie and I did discuss some of the requirements for licensure and some of the changes that the regulation just took effect just a few months ago in terms of the changes to regulation. Leslie, is there anything else you wanted to add for the advisory committee to consider if they want to make any recommendations or changes?
I don't think so. I mean, I think we discussed it and the committee didn't have any. I don't think I have anything else.
that was kind of my recollection too, but we wanted to make sure that we had concluded the conversation with everyone and then with new members too, just understanding the process in which we were looking at those regulations. Anyone have anything that they want to consider?
I didn't have any concerns.
Okay, thank you. All right, well, I'm hearing none, Dave, so I think we're finally done with that item on our agenda, so thank you for that. And we'll move on to the next item of business, which is continued discussion on the survey questions. Dave has supplied in the email some potential suggestions for questions, and so I imagine he'll want to share screen and put those up for us to talk about today.
Yeah. Thank you, Mary. I'll go ahead and share my screen. I presented in your packet of material some draft questions. So for those of you that are new to the advisory committee, a few years back, the Social Work Advisory Committee had requested a survey be put together to poll social workers that were licensed in Kansas on a number of different topics. And we polled the social workers. We were able to put together a report, and we've done a couple of those that the reports are posted on the BSRB website, and people can go back and review those. It occurred to me that if we are assisting one of the advisory committees with this process, there might be a lot of value in the other professions, at least having a conversation if they thought this might be helpful for their licensees to also be polled. It might help identify some areas where the advisory committees could focus attention. We know that we were created by the legislature as a public protection agency, and so this might be a nice way to hear directly from licensees. So I'll share my screen here and we can go over some of the questions. I have been able to meet with most of the other advisory committees and discuss possible questions with them. So what you have here is sort of a combination between the discussion your advisory committee had last meeting, plus some of the questions some of the other committees discussed that I thought would be helpful and can also be used for yours as well. So if you have any recommendations on changes to language, or if we go through this and you have a question you think would be helpful to add, we can definitely do that. Or any comments about the existing questions on this list. So first, as you are aware, there's 2 levels of permanent licensure in Kansas. We have the licensed marriage and family therapist, which is the non-clinical level of permanent license, and then the licensed clinical marriage and family therapist, LCMFT. And so the plan is to go ahead and send out the list of questions to each group of licensees separately, and then combine the responses on questions that are relevant for that, or if there are questions only for one group, only that group will get that question. So that way we can kind of make sure that only one group of licensees is answering a question if that is relevant to the question. But we also included some language here explaining that this is a survey from the Marriage and Family Therapy Advisory Committee for the BSRB. It's a short survey. We think it will probably only take about 10 minutes. Now, there are some open-ended questions. So if some individuals want to add a lot more information, it could take longer, but that's completely up to them. And so basically just starting off, I'll go through these questions. There's some demographic questions to make sure we have a good sampling. It says, in what county or counties do you practice the profession of marriage and family therapy? And part of the reason this is a helpful question is we have some individuals who live out of state, and this is a good way for us to see the individuals who live out of state. Also, if some individuals want to go back and see if a county was represented in terms of who responded, they can do a search based on the list of counties, and they can find that county in the list. Do you practice in a predominantly urban area, frontier or rural area, or frontier area? There has been some discussion about some individuals may not know the definition of frontier area or what might be the distinction between frontier and certain rural areas. So I'll try to add a little bit of a definition there to help people know which one of those they should mark. Do you primarily work in public practice, private practice, education, or another area? And then maybe have an open field if they respond to other. Basically, just to kind of get a better understanding of what areas they do work in, if it's a combination of several, if it's something that they didn't feel fit these categories. might help us understand the workforce and licensees a little bit better. What is the highest level of permanent license you've obtained in Kansas in the marriage and family therapy profession? And I did note on here, if we send this out to different groups, we will probably not include this question because we will know this was a question that was sent just to the LMFTs or just to the LCMFTs. But then how many years have you practiced in the marriage and family therapy profession? Combined years of experience if you have held both an LMFT and an LCMFT license. So that gives us an idea of individuals responding to this survey, if these are people who've been licensed for a number of years or those that are relatively new to practicing. Question 5, including your LMFT or LCMFT license in Kansas, how many permanent marriage and family therapy licenses do you currently hold in the marriage and family therapy profession combined between all states? There has been a little bit of a conversation about a potential compact for marriage and family therapists, but as of right now, there has not been enough interest at the national level for that to move forward to a drafting phase, or CSG is not working on obtaining a grant for the marriage and family therapy profession. But if something, there should be some movement on this in the future, it'd be nice to know how many individuals who practice here also have licenses in other states. That would be helpful for that purpose. Question 6, for the LMFTs only, how many years have you held an LMFT license in Kansas? Less than a year, at least 1 year, but less than 2 years, at least 2 years, but less than 5, etc. And really question 6 is a setup for question 7. Question 7 says, this is for individuals who've held an LMFT license in Kansas for at least 2 years. Are you taking steps to pursue a licensed clinical marriage and family therapy license? If you are not taking steps to become an LCMFT, could you explain why you made that decision? And we do have sort of some unique aspects in Kansas when it comes to our levels of permanent license. I believe there's only a couple states that have 2 levels of permanent license for marriage and family therapy, maybe Kansas and Ohio. And the same is true for professional counseling. We have 2 levels, one at the clinical level and one below the clinical level. Now, master's level psychology is kind of its own separate topic, but we do have 2 levels of professional or permanent licensing under master's level psychology. There's only about 17 states that license master's level psychologists, but even the ones that do generally don't have 2 levels of permanent license. But it would be helpful to know for individuals who are staying at the non-clinical level, or at least have stayed there for some period of time, it would be helpful for us to know the reason why they are not advancing to the clinical level. And then moving to some practice-related questions. In a traditional month, what percentage of your work involves providing direct services to clients? And then we thought it could be helpful to provide a definition of what we mean by direct services. For example, you could have individuals who are providing therapy to clients, but part of the work when you're doing that, you will need to do paperwork, and we wouldn't want people to rule out that time because it's not directly time with the patient, though it is something that has to be done, so it shouldn't really be excluded. But that could be something that individuals could come to different understandings. So we want to provide some clarity in terms of direct services. But this kind of also goes towards looking at workforce and looking at quantifying our licensees. What percentage of their work is providing services to clients versus working maybe in other fields, working purely in administration, etc. So this will help us understand that, or maybe someone who has practicing, but they want to make sure they keep their license active. And so this will help us understand that a little better too. For the clinical level practitioners only, since recent changes in federal law that allowed clinical level marriage and family therapists to seek Medicare reimbursements for certain services, do you seek Medicare reimbursement? Have you experienced any negative issues with this process? And for the BSRB, we are honestly a small fish when it comes to reimbursement. Most of the financial aspects for licensees it's under the Department for Aging and Disability Services, KDAD, or the Department of Health and Environment, KDHE. However, we know that when we're looking at being part of the conversation in terms of workforce, reimbursements are a major part of that conversation. So this will be a nice way that we can at least gather some data on this topic. And maybe when we're having conversations with those other state agencies, we'll be able to share this information that will be helpful for them and ultimately helpful for licensees and members of the public. Question 10, or question 9, currently no multi-state compact exists for the marriage and family therapy profession. If a multi-state compact was created under a model that would allow individuals to practice in other compact states by changing from a single state license to a multi-state license at a higher cost than a traditional single state license, would you be interested in obtaining a multi-state license under such a compact? If no, why not? And I know that was kind of confusing if you're not used to all the conversation about compacts. Currently, right now, for the licensed professions under the BSRB, Kansas has passed legislation to join 3 of those compacts. There is one for psychologists that is called PIPAC. There's one for professional counselors that is a professional counselor multi-state compact. And then most recently, there was a compact for social workers that was passed. Each of those compacts is set up differently, so there's different models. But the compact passed by social workers, I think, is the one that most people have heard about. And that would say what you're currently doing right now is every state has authority to regulate practitioners in your state. And so if you want to practice in your state, you would normally get a license. And that would be essentially a single state license. You get a license in Kansas that lets you practice in Kansas. Under this social work multi-state model, you would be able to have states start to issue a brand new type of license, a multi-state license. A multi-state license would say, yes, you could practice in the state where you're living, your home state, but you could now also practice in all the other compact states. And so being able to offer both a single state license and a multi-state license would give people the flexibility to choose. Do you want to get a license that lets you practice just in your home state, or do you want to get one that lets you practice in the other compact states? So getting some interest in multi-state compacts, I thought it would be helpful just to pick one route and then clarify that, under that type of arrangement, what would happen generally is we have about 30% of our licensees for some professions, where about 30% of our licensees live out of state. And so if states can start to issue multi-state licenses, there's not the incentive to become licensed in all the different states or several different states. It makes a lot more sense just to get a multi-state license where you live. So we would expect that we would lose some out-of-state licensees. But to make up for part of that is we would be able to charge a higher amount for a multi-state license. And also we would also be investigating complaints potentially of that licensee when they provided telehealth or in-person services all over the place. So there's also sort of a direct connection there to why it would be more expensive. But anyway, I just wanted to kind of frame that exactly why I chose that direction. But that would at least let us collect some information on our number of licensees that would be interested in a hypothetical multi-state compact if one were to be offered. That's question number 9. In question 10, over the past 2 years, based on observations and experience practicing in the marriage and family therapy profession in Kansas, could you share information on any practice-related issues you have seen, such as areas where practitioners appeared to need more continuing education or training in a certain area? And I think that's a great question, basically to collect feedback from licensees in terms of any practice-related issues that are going on in the field. If we were to get a lot of information about a specific area where people are really struggling, that could be something for the board to consider some changes on in the future. Question 11, over the past 2 years, have you observed or experienced any positive aspects or negative issues concerning telehealth, either through professional practice or observations of other practitioners? So just recently, over the last few years, the board really opened up a lot of the ability to do telehealth. Supervision, now you can do all of that through telehealth if you choose to do that versus having in-person supervision or some sort of a split. There's also the ability to provide services to clients, which has gotten a lot more popular since the start of the pandemic. And so we have heard that some individuals have experienced a lot of positive aspects, especially with being able to do supervision by televideo. But it would be helpful to hear from licensees to see if perhaps there have been issues that have been identified, or is this really helpful? And it would be nice to get some feedback that the actions of the board have really led to some positive results. So because potentially there may be additional things that could be done to help other individuals in that area. Question 12, for the clinical marriage and family therapist, do you currently provide clinical supervision? If you do not provide supervision, could you share why you do not provide supervision? This could help us in terms of knowing if there are obstacles that maybe would be preventing certain people from being able to provide supervision, or we know how many people theoretically could provide supervision if they chose to go down that path, but this could be helpful information as well. Another question for the clinical practitioners: if you provide clinical level supervision, what negative issues have you experienced or observed while providing supervision? We do not only, the BSRB is not only charged to license and regulate practitioners, we also investigate complaints against practitioners. And so occasionally we do see certain issues that come to light during the supervision process. And so that could be helpful for us to get a better understanding of the relationship between supervisors and supervisees, or what maybe we could have supervisors target when they're working with supervisees. Alternatively, question 12.2, question for LMFTs only: if you're receiving clinical level supervision, what negative issues have you experienced or observed while receiving supervision? So if there are supervisors out in the field that are providing some, supervision that may be below the certain standard that we would want to see, or if there are issues in terms of that relationship, that would be something helpful for the advisory committee to collect some feedback on. Question 13, to assist the work of the board, the BSRB has 7 standing subcommittees called advisory committees, which are largely composed of licensees in each of the 7 professions regulated by the board. The advisory committees discuss topics relevant to the work of the board and make recommendations to the board on potential changes to statutes and regulations governing the profession. On a scale of 1 to 4, how familiar are you with the work of the Marriage and Family Therapy Advisory Committee? So this is an effort to spotlight the work of the advisory committee and kind of share awareness of the work of this committee. And since we are broadcasting meetings, these are conversations and topics that a lot of other licensees could be learning about and having a role in. So this might be a way to see how familiar our licensees are with the work of the advisory committee. Question 14, do you currently use artificial intelligence in your practice? If you do, what tools do you use? And the board recently had a conversation about the regulation of artificial intelligence. That is on the agenda for more discussion today, but it would be helpful for us to hear from practitioners if they are currently using it, and if so, how they're using it. And then question 15, do you have any other comments or feedback you think would be helpful for the members of the Marriage and Family Therapy Advisory Committee of the BSRB to receive when evaluating possible changes to the statutes and regulations for the marriage and family therapy profession? So sort of a catch-all question, but in case there wasn't an opportunity for someone to provide some helpful feedback to us previously, this could be the last opportunity for them to provide good information to us. So that's what we have as a draft. I'll go ahead and open it up and see if anybody has any questions on any of these questions, or if there were areas that were not covered that you think would be helpful to include, or any thoughts on anything else related to the survey.
I think this is a nice document, and I really appreciate the work that everybody's put in on it. I do have a question that relates to when it asks what problems they've have seen. Have there been discussion around if there are things that come up that would actually be something that should be reported for disciplinary purposes? So somebody reports, alcohol use during sessions, or their supervisee has done some things that could face disciplinary procedures, because this isn't a reporting document. So I'm just wondering what the discussion around that has been.
That's a good question. Yeah, so So I mentioned that the BSRB is charged to not only, license and regulate professionals, but investigate complaints against practitioners. But when we do have the subset of the board that does review those complaints, things have to progress to a certain point for those to actually get in front of the complaint review committee. And so I guess what I would think about in response to your question is someone has to basically attach their name to a complaint and provide that to the board for us really to be aware of it, or it has to be something that is very easily verifiable. When someone applies for licensure and we notice the issue, that we can file the complaint. But generally, those come from individuals in the field or from clients who've received services. And so it makes me wonder if there are other issues that don't get quite to the point to where someone would file a complaint, but it would be helpful for the board to know there may be an issue in this area that we could start to target or learn from other states in terms of being proactive on. But if anyone else has any thoughts along those lines, I'd be curious to hear what your thoughts were in response to Marcy's question.
I wonder if people might write down complaints, and I like the supervisor situation is a little different than the one it's 12.2. You receive supervision, and what negative issues have you experienced? That one seems more likely for me of like they just report something negative and they don't even know it's reportable. So at that point, like, is it our responsibility? And when I say ours, I don't necessarily know if it's like mine or the BSRB's responsibility to reach out to that person and say, like, this is reportable. Would you like to further take this as a complaint versus, I don't know. It just feels like you wouldn't want someone to say something that they didn't know was reportable and then just report it anyways.
I guess my question ties in with what Heidi was saying is I couldn't remember whether it said that this survey was going to be touted as a confidential survey or they were going to be tracked. Because if you do go the route of the confidential feedback, you're not going to be able to identify easily who the person is making the statements, which could put everybody in a tough spot.
Yeah, I think those are really good comments. And David, I don't know if we talked about confidentiality as much, but when I'm thinking about this, I'm thinking, I mean, I probably wouldn't, if I were answering this, I would say something like, it would maybe supervisee training or something like that. I don't perceive getting into a specific situation. So is that something, one, David, answer the confidentiality thing. Two, in the surveys that you've seen so far, are you getting, that level data coming in? Or did any other groups talk about qualifying that, or maybe saying, in global ways, what kind of issues you've been having, or just getting your thoughts there?
Yeah, so the surveys are confidential in the fact that we don't match the response to the person who completes it. We do keep track of who's responded to it and who hasn't. That way we can send some targeted updates to people who haven't responded to the first time we send it out. And for those that already have completed it, we don't want to keep sending them emails because they've already completed it. So we have a general sense of who's completed it, but not one person's response tied to that particular person. And in the past, you may want to take a look at some of the reports that we have on the website. They are, I believe, under resources, and there's a survey of the social workers. I believe that was from 2021, and then also one from earlier this year in 2024. And we asked them some questions. I believe some of the most recent questions dealt with supervision and if there were any positive or negative aspects of supervision by televideo. And nobody identified a particular person. They might have talked to us about specific instances where they thought there were issues, but never used any kind of identifiable information about a supervisor or a supervisee in that context. And
So
then
would this, I'm sorry, go ahead. Sorry.
Oh, and just to kind of let you know too. So in my position, I have a kind of a unique role. I attend national association meetings for some of the other professions. And when you talk to individuals from other states, they have lots of different requirements or rules that we do not. For example, when it comes to supervision, we require there to be a contract in advance. Some states don't. Some states, you are just able to go out there and start to accrue hours. We have a plan that you have to have approved, which includes the name of your supervisor. Some states don't. They just allow you to get supervision from anyone who would meet a certain standard. And then there are mechanisms where they can report it. And I've heard from some other states they struggle because they have some individuals who get supervision hours reported by up to 25 different people. And so they're struggling with getting consistent feedback from supervisors because they're being supervised by so many different people. And so there are different issues that different states are struggling with, but a lot of that has to do with the system that they have set up. And so being able to ask this kind of broadly could help us kind of target, what areas our system is maybe showing success, or maybe we could learn from some other states in terms of implementing some of the changes they have. But sorry, Mary, didn't mean to cut you off on that.
No, thank you very much for that. I just was wondering if the committee's making a recommendation about editing that question in light of this discussion, or do we feel comfortable with the content as it is?
Would it be appropriate to add just a sentence that there is a formal, or there is a procedure for reporting egregious, issues, or this is not a reporting tool for some of those things that they might be reportable?
So maybe something like so what negative issues have you experienced or observed while providing supervision? And then parentheses without identifying a specific supervisee, and then maybe a note, something about there is a process to complete a form if you do have a report of alleged violation on a specific licensee or something like that.
I think that would be helpful, and maybe add something similar to the question 12 too as well.
I will adjust that language a little bit better afterwards, but so maybe have something similar here without identifying a specific supervisor. Something like that. Okay. And then maybe some language here about trying to think of another word for confidential.
What about anonymous?
Yeah. Something like that. Yeah, maybe I'll just leave it as anonymous, because on some of these we will have the opportunity for them to make specific statements. In the past, we really tried as much as possible to retain the specific language that was provided, because I think that can be helpful to pick those individual comments out versus trying to combine it all and summarize it generally. So, but yeah, it would be anonymous, so we don't know if someone said a particular thing that is this particular licensing. Good feedback. Really appreciate that.
David, I had another thought on question 12.
Okay.
Mostly because I just sit in the category here. So, do you currently provide clinical supervision? If not, share why. Are we trying to specify out who isn't even taking the approved supervisor track, or just like you may be an approved supervisor, but no one? It's hard to compete with free supervision at the because that's where I am. Like, I'm an approved supervisor. I would love to be providing supervision, but I can't offer free supervision, and places in town can. So I don't know that matters, that it's, if that would just kind of weed itself out, or if we're interested in, like, are you as a LCMFT just not even interested in providing supervision?
I think there could be several different responses to that question, and I'm curious how prevalent those responses would be. I wonder if some people might say, I know I need to become a board approved supervisor and I don't want to do what's required to become a board approved supervisor. Or some people could say, I used to provide supervision, but even though I'm officially still a board approved supervisor, that's not what I do any longer. Or some people could say, I have 20 supervisees and I physically don't think I could take any more. And if someone does have 20 supervisees, that would be something we should probably know about as well, to make sure they're still providing quality supervision to all those individuals. So I think there could be a few different scenarios, but right now, a lot of this is not being tracked on an individual basis. So this might be a helpful way for us to kind of, hear about any kind of issues like that, or like we said, board approved supervisors are only for the marriage and family therapy profession and professional counselors. And at times we have heard from people who said, I'm having a hard time finding a supervisor. And so when we look at the list of clinical licensees, there may be reasons why, aside from being a board approved supervisor, there may be other reasons why people wouldn't necessarily provide supervision. But it would be nice to hear from that group, that category, to see if that really is one of the biggest reasons why people aren't providing supervision. I don't like anecdotal information. Sometimes when I go to committees and I hear people assert things, it makes me question that. But if there's no data, it's really hard to prove things. And so one of the nice things about a survey like this is it will at least allow us to collect some qualitative information and maybe quantitative information. That way, if people are trying to understand things, which I think we all should be trying to do, this could be a way for us to gather some of that information by hearing directly from licensees.
Okay.
David, I did have one question, and it's just a general, because I wasn't around when the questions were formulated. In the beginning, when you're asking all the demographic questions, was there any thought or consideration or ideas about possibly asking the direct question about how much time, or how, if you offer telehealth? Because then that could be tied into later on when you're trying to determine the multi-state, that would give you a baseline of people providing telehealth who might be more likely to apply for a multi-state license.
Yeah,
Just
that's
a thought.
a really good point.
It would kind of cross-reference the two within the survey a
Yeah.
little bit. Not that I want to add another question to your already long list, but it was just a thought that came up as we were reading through.
Well, and like I said, some of these questions will only go to the clinical level. So it's a little bit messy because I have decimal points. We kind of built a set of questions and then added to it, and not the final version, but I think it'll probably be somewhere around 15 questions for most of them. But I think that's a really good question. Do you use telehealth, and maybe what percent of your work is telehealth?
I think it would give you a nice baseline of practitioners who are practicing telehealth.
All right, great. Maybe maybe fit that question here.
I don't know what anybody else might think. It was just something that popped in my head.
No, I think that's great. And kind of 2 items, yes, no, and then percentage of time. So I think those will be good pieces of information.
I'll work on some of the phrasing of that, but it is kind of funny when we use the term face to face. I think in some contexts, face to face was thought of as, well, of course, you're going to be there in person. What other way could you be face to face? Except now we have a lot more ways to do that. So, but no, that's a very good question, and I think it's helpful to know sort of telehealth, or at least remote access when it comes to things like providing supervision, but providing services as well. That is something it would be nice for us to know, because that may also feed into the ability to do a multi-state compact. We've talked a little bit about some of the benefits of compacts being provider mobility, but also client mobility. If you have a client who goes away to college or goes on vacation, if you're used to providing telehealth services, then you can just extend those services when the person goes out of state. That could be really beneficial to people. Any other questions or suggestions of changes for the survey? Just to let you all know, I know some of you are new to the committee. The tool we would be using to send this out is SurveyMonkey. And so what we did last time is we sent a message, an email directly from the BSRB inbox to let people know that they would be receiving the survey from SurveyMonkey. And so that way they could respond to it. The email they get is specific to them. That way we know people aren't taking the link and putting it on a message board, and then who knows who is clicking on that. We want to verify that these are actual the licensees that are responding to the survey, but we also know that if we just were to send a direct message from SurveyMonkey to them to begin with, it probably might, or at least some people would go to their spam filter. So we start off with a message from the BSRB, and then after that, we kind of follow it up using SurveyMonkey. But to let you know the effectiveness, when the social workers did their last survey using this targeted approach, I think there were close to maybe 8,000 social workers, something like that. And I think when all was said and done, we got responses back from nearly 3,000 of the social workers. So not quite half, but still pretty big percentage, maybe 40% or so, which we were really happy with. The previous response rate, we had received about 1,000 responses 3 years earlier, when the number of social workers was a little bit smaller, but not significantly smaller. So hopefully we'll get a pretty good response rate for each of the professions. And then this will be what I will normally do is put this out, collect the information, clean it up, and then make a report, and then provide that to you and the advisory committee. We can review those responses together, and then that'll also get forwarded to the board so they can kind of view the information too. Well, if there's no other questions, I will just go ahead and clean it up. And I feel like we're probably at a good point to go ahead and send this out once it's cleaned up. So if there is time between now and the next meeting, I will make sure that we send this out and have the report ready for you at the next meeting.
Okay, great. Thank you, Dave. Thanks everyone for your feedback. Those are some really good comments. So thank you for those notes today. We'll move on to the item, a new business, and to the discussion on regulation of artificial intelligence.
Okay, so this is a topic that is very relevant to each of the professions. The board recently had a conversation knowing that there are practitioners out there using artificial intelligence in their work. How can we as a licensing board that is charged to protect the public, how can we provide guidance and something helpful for licensees and expectations really in the area of artificial intelligence? And I think part of this conversation has been to start to have each of the professions discuss this so that we have a better awareness of what actually is artificial intelligence. And then as you saw, there was a survey question about how practitioners are using artificial intelligence in their work. So I think there can be a little bit of confusion or difference in understanding in terms of what artificial intelligence even is. And so the board did refer this to the advisory committees to start the conversation on this topic. And that if you can reach any recommendations, those could be forwarded back to the board. And then ultimately the board can make a decision about if this is something that should be addressed through the unprofessional conduct regulation or perhaps another method.
Yeah, I know this is such a challenging topic, I think, for everyone, because we all know it's here and happening, and there's nothing referencing that in some of the conversations I've had with colleagues. It's, you have to be careful how you phrase any type of language because it'll outdate itself before it ever gets through any type of approval process. So I think the challenge is, to some extent, we all believe this, there needs to be some regulation on it. And then how do we do that in a way that's effective for our profession? So open that up for conversation for sure. It's just too big to tackle.
Well, I will throw myself on the fire. I have actually been contemplating using AI in my practice, predominantly on the note side, which is like a medical scribe. But I know there is a lot of discussion in the press about using AI as a therapeutic intervention. So I think that there's multiple pieces to AI that we would have to consider, not just blanket. Like we would have to consider each use and how to regulate each use. I do even with thinking about it in my own practice, I do believe that things need to be regulated because guidelines are always a good idea and structure is always a positive thing. So that's just, at first glance, that's my thinking.
I'm speaking as a risk manager, just representing the public. When I was a risk manager, I had responsibility for 450 physicians and 700 extenders, PAs, APRNs. From the perspective of notes, if chatbots are going to be used, it's got to be, in my opinion, the way I held my medical staff responsible. You're responsible for the note and the report in anything that's released. So I don't have a problem as much using a chatbot to generate notes because an individual practitioner should still be held accountable for his or her note as it's released and signed. You can't blame the chatbot. This started 15 years ago when doctors said, well, can we use templates and fill in the blank kind of thing? And I'm like, I guess you can. There's a lot of procedural things in a report that are pretty standard. I said, but you must not lose sight of the individual patient. From a referring problem, the doctors have just started to get into this now, and I still remain active with some of the physicians there. There is some concern with AI and how you would refer a patient to AI. And in medicine, it might be a little different. I don't Still, I'm looking, quite frankly, for you all. I'm looking for all the legal cases that may come out with the use of AI in this profession and everything the BSRB does. I am monitoring and watching. I've got 3 law firms looking for me, just because we really don't know what we don't know, and the first case will define what we should have known. At least in the matter of, at least in the opinion of the black robe sitting at the edge of the bench or to the jury. So I'm just cautious about this. David knows I'm a little squeamish about it, but that's my opinion, and I'll be on the side.
I think to follow up
Sorry.
with Jim, yeah, it's one thing to have AI generate your note and then you can read the note before you sign it. It's another to say, hey, my practice is full, but you can talk to my AI therapist while you're on my wait list, because you just don't know what they're going to say. But yet you're responsible for what is being said.
And I agree with that too. I am definitely squeamish about that part. I'm even, like I said, I'm considering it. I've been considering it for over a month because I'm still sitting with it going, I don't know. So I'm definitely squeamish about having an AI interact with clients. Just, there's too many ways it could go sideways.
I think one of the interesting things about a body like this, and also in a larger sense, the board of the BSRB, is that we'll go through this in our training, but we are creatures of statute. So we're defined by law. And so we are charged to put out legal standards. And versus, let's say, an association may try to put out something like best practices. Often what the BSRB is in charge of doing is enforcing the law. And so it's really kind of a different standard. It is, if someone does X, there should be a disciplinary remedy. And so it's kind of establishing a different type of standard, kind of saying, okay, we want to put out notice to practitioners about what is acceptable or what's not. But it's a little bit different of a role. We can't really say what someone should do. It's more of, we have to be a little bit more rigid if we were to put something into law that kind of imposes a duty, or would say, here's where the line is in terms of having disciplinary punishment. So I just wanted to throw that out there for the conversation.
Yeah. I think that's
David.
good. And when I think about this before, I'd gone to a conference where this topic was discussed pretty heavily. I think about the guardrails and what's on our purview, and I think about informed consent, which is in and of itself a little challenging because do practitioners really understand how information is used and stored and protected? And then I think about, again, compliance, HIPAA compliance. And if you're looking at some minimum standards, to me, they're around informed consent, so that your client knows that the use of AI is happening, and that then as a practitioner, you've chosen to use a system or a tool that has some assurances of confidentiality and how data is used. So those are the things I sort of think about initially.
David, from a statutory regulatory perspective, could an argument be made that an AI bot is not licensed and therefore ineligible to practice within the state? And so I'd like to take that one before the black robe, first of all, for a legal opinion, because it's my belief, the way the statute's reads now, that an AI would not be eligible to provide counseling services under our current law.
So if we want to get into kind of
well, I don't want to get into it. I just because it's a big conversation.
No, it's a very valid point, and I think this is kind of one of those things when we're talking about modernizing the language and certain regulations and statutes. I think a lot of these were written with a certain framework that assumed certain things and then built around it, which is very logical. But sort of like where schools, when we were looking at educational requirements for licensure, there was not a thought that people could be face to face by screen because that technology wasn't widely accessible or maybe didn't exist on some level when some of those things were written. I feel like when you look at the unprofessional conduct language, a lot of that is written from the perspective of a person providing services. It says, these are the things that would apply to an applicant for licensure or someone who is licensed to do XYZ. And it really kind of builds on the assumption that we're talking about a person versus technology. And then you have to go down the road of saying, okay, well, if the technology did this, are we going to hold the person who created the technology accountable for what the technology goes and does? And I think that's a fair question to ask as well. And someone I thought maybe said that we were playing catch up, and I think that is true in certain ways. On the other hand, I can tell you that the associations for the levels profession, they're having these conversations now too. So I think we're all kind of playing catch up, but I think it's important that we try to dig in and do the work so that we're all on the maybe not all on the same page, but that we have a good education about these topics. And if we can add some value and then we can build on it in future years, knowing that we have a moving target, knowing that technology is going to be changing, our understanding is going to be changing. I think if we can add value today and then improve upon it tomorrow, that's probably a good position to take.
I also think it's just unrealistic that you're going to be able to regulate all AI. Like, for example, I could go on to, I think it's like Gemini or whatever, and be like, Gemini, I feel sad and depressed, help me. And it will tell me things. Like I can treat any of these AIs like a therapist, but we can't actually prosecute that. Like we can't regulate that. That's where I think it has to come back to if a therapist is saying, hey, like I'm not available 24/7, but my AI is, or, something like that, where there's actually, it reminds me a lot of like, okay, if you're saying this is part of my practice and I am endorsing it, you need to be familiar with what it's doing. Kind of like if you had a supervisee saying, hey, this is a supervisee that you could see and they would be great. Well, if they're, getting high with clients, then you're responsible for that ultimately. So I think that diving into the whole AI and how we regulate it is going to be way too big of a process for not just the BSRB, but probably like, I don't know, the United States government. But trying to really regulate, we can only hold our licensees accountable here.
Yeah, we do have
Yeah,
the
go ahead.
ability to when we have the ability to do certain things when someone is doing the unauthorized practice of a profession, but our tools in that area are somewhat limited. And so we do have much more control over the licensees that we regulate. That is for sure.
Yeah, I mean, the way, again, for me to conceptualize it is to look at the things that the licensee is responsible for, and that is informed consent. If I practice a particular modality, I have to be able to explain that to my client and make sure there's informed consent. So if I'm using an AI note taker, or if I'm using some type of system that's listening to our sessions to transcribe, then I need to be able to provide a minimum level of informed consent about that and an assurance that it's protected information. And I think if we start somewhere around that knowledge, that to me seems a lot more reasonable to hold the licensee accountable for that, not whatever company out here, and however that's outside of our control. But I think it's, to me, I can liken it to any other tool I might use in therapy. I have to be able to explain to my clients its risks and benefits and what I know about it.
Well, I can tell you each of the advisory committees is having a similar discussion about artificial intelligence. If you are aware of anyone who might be a good presenter for the advisory committee to talk about this topic, feel free to connect me to them. I'm happy to reach out and have a conversation. One of the really nice things about this format for the advisory committees is that it's really easy to have presentations by individuals from all over the United States or potentially even the world. In the last month, we've had a number of guest presenters at different advisory committees on different topics, but this could be an area that if you are familiar with someone that you think could add some information to help the advisory committee understand this topic, or someone who you went to a CE that you thought was pretty quality and you thought, at least as it relates to this profession, that might be something we could look into a little bit deeper, feel free to let me know, and I'm happy to reach out to any of those individuals, either to present information or maybe they could provide a document to us that could help our summer work in this area too.
Well, it's good that we're talking about it, and I think we need to continue. It'll be one of those topics that we'll continue to have. But yeah, if anyone else has a resource that we can share, we'd be happy to take that too.
And this is a nice way to kind of segue for those of you that are new to the committee. If you ever do have documents like that after the committee, best way for us to distribute those is just go ahead and send them to me and then ask that they can be forwarded to the advisory committee. And then I'll go ahead and send those out. And then I'll probably include those in your packet for the next meeting too, just as a reminder. But that way, in between the meetings, you can kind of review those and then, maybe be thinking of ideas to bring to the next advisory committee meeting. And so I'll make you aware of that process too.
Thank you, David. Well, we'll go to the next discussion item, which is B, which is adding a description of each profession on the BSR website to inform the public of the differences between the professions.
Okay, so this is another topic that we discussed at a recent board meeting, and the board decided to refer this to the advisory committee. Basically, there has been some discussion over the years that we regulate 7 professions, and in some ways there are areas that are similar between the professions, but there are also uniquenesses, and it may be difficult for members of the public to really understand some of the professions. So we have FAQ sections on our website, but most of that information is for licensees to kind of help them understand what they need to do to provide when they apply for licensure. But we also have members of the public that visit our website and may be trying to understand, what the profession is. And so we thought it could be helpful for to add information on the BSRB website for each of the professions that is more of a general description of the profession with the public in mind, so that the public would have a better understanding of these professions. And in your packet of material, I did include a couple documents for you. I'll go ahead and share my screen here, and we can take a look at those sort of as just starting points or information that could be helpful as part of this discussion. You see a copy of KSA 65-6402. And for those of you that are new to the committee, this is a statute, so this is law. And Kansas statutes annotated as the KSA. And so these are part of the licensure act for the marriage and family therapy profession. But this is what the legal technical definitions are in the Marriage and Family Therapy Licensure Act. So in this item E defines marriage and family therapy, which means the assessment and treatment of cognitive, affective, or behavioral problems with the context of marital and family systems, and includes the diagnosis and treatment of mental disorders as authorized under the Marriage and Family Therapist Licensure Act. Like I said, this is a technical and legal definition, and it does serve a purpose, but for a member of the public, I think they might have limited value that they could take from that in terms of trying to understand the marriage and family therapy profession. There is also included in the statute a definition of licensed marriage and family therapist compared to licensed clinical marriage and family therapist, which there is a pretty important difference there, and those are helpful in terms of understanding those differences as well. But this kind of shows a little bit of some of the legal definitions for those terms. We started this conversation at the last meeting. In your packet of material, you should also see a sort of a handout. Following the last meeting, outgoing advisory committee member Jardine Coleman provided some language that I thought could be helpful for this discussion too. She said, in terms of describing the marriage and family therapy profession, a marriage and family therapist, also known as a couple and family therapist, is a trained mental health professional, I think it's professional, that focuses on the interconnectedness of people and their world. And MFT will focus on how the relationships you engage in impact your mental health. MFTs can use skills and techniques you might find in other professions with a particular focus on healing connections in the person's life to positively improve their mental health. Now, I do not have an educational background in any of the 7 professions regulated by the BSRB. So I cannot speak from a perspective of someone who understands, the focus of some of the terminology for the profession. But I think that this is a nice step from the legal definition to talking about some of these type things in terms of looking at the focus being on healing connections. I think that could be some helpful language for members of the public. And maybe we can take this and even go a step further. If there's things that you as advisory committee members think could be helpful. The purpose of this exercise is really to try to let each of the advisory committee members or the advisory committees, add to this discussion. You know your profession, and if you could think about it from the context of a member of the public who's not educated in this area, not trained in this field, but is trying to understand this profession and alternatively each of the professions the BSRB regulates. So I'll turn it over to all of you, but I thought I might frame this before we open it up for conversation.
Yeah, thank you for that. I think for me, as I've thought about it a little bit, the difficulty is bridging the legal with something that makes sense to people. And yet, I feel really compelled that we ensure that we keep diagnosis and treatment in there of mental disorders, because I think that can get lost for people, and or maybe a lack of understanding that that is actually a function of MFTs. So that would be just something I would want to keep in mind somewhere. And then the concern of if it's on the BSRB as sort of an explanatory definition, do we still reference a legal definition so there wouldn't be confusion that, let's say, someone wanted to take that definition out of context and use it against, I think about states where some of the rights of MFTs have maybe been challenged in terms of diagnosis and treatment, or even in our own court systems where there's a lack of understanding about what an MFT can do. So just some thoughts I've had since we last talked.
Yeah, I kind of had some thoughts along a similar line. There's technical aspects that I think we would want to include in some of these definitions. For example, we have some people from other states say, oh, well, you have a clinical level license and you have a provisional license. And it's like, well, no, we don't. I understand that's what you may call it, but it's going to be something different for you because yours may not be a permanent license. So I was thinking from a technical standpoint, we would want to stress too that each of these levels of license is a permanent level of license, and a few technical aspects like that. So while we started this conversation talking broadly, I think there will be some specifics that we want to make sure are included there. And I think you bring up a good point, because someone could just grab this and say, well, that must be their definition. So we would probably want to put some, at least footnotes, that the legal definition is included maybe here. So.
When I had read this also, I wondered in that area, I think it's on the 3rd line, as a trained mental health professional, I wondered about saying that works with individuals and focuses on the interconnectedness. And the reason I say that is I know that, and I don't know about others, but I get asked a lot, so do you only see couples and families? And that's not the case. In fact, we see tons of it, primarily individuals. And so, but we do focus on like these pieces of how, their relationships impact them as individuals. I don't know if that's important to have in here. But I've thought about that a lot just over the years of being an MFT um, actually, when I was a student, it was a hustle to try to get those relational hours, but I worked so strongly with individuals on those connections, even if those connections weren't in the office with us. And so I just don't know if that would be a helpful distinction to add in there, that we are working as mental health professionals with individuals with a focus on X, Y, and Z.
I had a similar thought to Nicole, but not just saying individuals, but ironing out individuals, couples, and families, so that it's because like the common layperson might not know.
I think that's what I was going to add too. I'm wondering where it says people, working with people, if we could say working with individuals, couples, and families, and how their interconnectedness. I don't have it in front of me now, but changing people to individuals, couples, and families. I do like many of the things about this. I think it has a systemic feel to it. I like that the also called couple and family therapy. I know our K-State program is couple and family therapy. So I appreciate that as well.
I really like what Jardine has done here. There's a part of me that wants to say more about the interconnectedness, and I don't have language in place, but I find myself thinking about not only mental health, but relational and emotional well-being, and understanding problems in the context of that interconnectedness or those social settings or those relational settings. And I agree with Mary, the diagnosis piece, such a huge piece that had to be fought in Missouri. I would want to make sure that that's there. And I agree, the couple and family therapist reframe is excellent. And that it's a trained mental health professional, that it's not it's people that are thinking it'd be nice to talk about couples, are all excellent aspects of that.
They sound like really good notes to start with, so we can work on the wording a little bit with these additions, and then we'll bring it back. I think that's a great springboard. I was grateful that Jardine sent that along the way, right after the last meeting, for us to begin thinking about this.
And I'm also grateful to have that delineation about the different approaches. I think that's excellent.
Well, as with other things, if there are other thoughts that come to your mind, please email Dave and we'll get that some work on the language to get incorporated to keep bringing back to you until we feel like we're close. But these were great notes.
Yeah, and for those of you that are new to the advisory committee, this can be like some homework until the next meeting. But I would encourage you to just think about how you would define marriage and family therapy to, friends or relatives, and then if they were to say, "But how is that different than professional counseling?" or "How is that different than social work or psychology?" That might be helpful to kind of approach it from both of those angles too, because that is something that we occasionally will hear from people, and um, it's nice to have a good understanding and hear directly from licensees in this area on this.
Okay. Thank you for that. The next item of business is talking about additional topics for the rest of this year, even into next year. So putting this in front of you to say, again, this is always a dialogue we want to have. If there are issues you're seeing in your areas or in the field that we want to explore a little bit more, please feel free to let us know. Does anyone have any thoughts right now of things that you'd like us to bring back to the next committee meetings? Well, certainly, again, you're welcome to think about it, and you can always email in between meetings to Dave and myself, or, we'll try to make it anything work. So let us know if there's something that comes to mind. We'll be glad to do that. Okay, well, not hearing anything else, want to go over the next meeting date. We would have tentatively scheduled, staying on this same rhythm here. It's on the October 11th, and there should already be a place saver on your calendar for us. So it'll be at the 10 a.m. time, and of course we'll meet remotely. Okay, is there anything else for the meeting today?
Mary, on that topic, is there another date in the year?
We should have a December meeting.
Has that date been decided?
It would be the 13th. It's tentatively on our calendars for the
Okay.
13th of
Yep, there
December.
it is. Yeah, okay. Good.
Okay. Any other questions, thoughts? Okay, well, if there's no other business, I will take a motion to adjourn.
So moved.
I can rely on Jim for that one. Second.
I was waiting, okay? I was waiting.
I second.
Thank you, Nicole. All those in favor say aye.
Aye.
Thank you guys so much for your work today. I always appreciate the comments and the collaboration, and we will see you in October.
Thank you.
Bye-bye.
Everyone.
Bye.